use of prescription painkillers recreationally is at epidemic levels. Over the last 15 years, there has been a 500% increase in the number of deaths due to opiate overdose. Dr. Joshua Weiner joins us this morning with a look at what has contributed to this problem and what we can do about it. So, what can we do about it?
This is a really tough problem. The number of prescriptions written for opiate pain medications has soared in the last 15 years. It's up about 500% as well. So these are very commonly prescribed medications like Vicodin, hydrocodone, oxycodone, Percocet. This is a tough problem. I think public awareness needs to be out there, and the DEA really is cracking down on doctors who are doing excessive prescribing of these medications.
What causes these medications, doctor, to be lethal?
So what these medications do is they slow down your breathing. So if you take way too much of them, it can actually cause you to stop breathing. So what people run into problems with is that they'll be regular users of, say, Percocet or OxyContin. Their body will develop a tolerance, so they'll continue to need more and more of the medication, and then maybe they'll stop using it, either because they need to, because they go to jail, or they enter a rehab program, and then they'll come back, and if they start using the same amount that they were used to using, it can be lethal for them at that point.
How much does pain tolerance factor in? Is it a case where if you can't take any pain, you feel you have to use more?
Well, what happens is your body gets so used to taking these medications, it builds a tolerance, and in order to get the same level of pain relief, your body just naturally continues to need more and more of the medication just to achieve the same effects. So it's a never-ending cycle. It's a vicious cycle.
If you come to see someone with an addiction, you yourself, how do you treat your patients who have such an addiction?
So the first thing I do is I do a type of interviewing called motivational interviewing. So the old style of dealing with people with addiction problems is to say to them, you are killing yourself, you're damaging your family, you're causing all these problems in your life. Can't you see this? You need to stop. It's the doctor telling them you need to stop.
And that's the old style.
The old style.
Which may not work.
Which doesn't work for a lot.
No one wants to hear that.
Exactly. Nobody wants to be told, I need to do something. They just dig their heels in and say, no, it's not really a problem. They start arguing with you as to why they don't need to stop. The motivational interviewing approach takes a very different slant where you're talking to them about things like, why do you like taking these pills? Tell me the good things about this. And then you're trying to get them to highlight the things that are causing problems in their lives. So they're the ones making the arguments for the reason that they need to stop using the pills.
I've read where sometimes these people who are addicted have to be medically assisted in terms of a detox program. What medications get them off of this addiction?
So the most common medications that are used to help people with opiate addiction are methadone, which a lot of people have heard about, and then there's another novel medication. It's been around for about 7 years. It's called buprenorphine. This is a really incredible medication. What's great about buprenorphine is it takes care of the withdrawals and it takes care of the cravings that people have for opiates, while at the same time you can't really abuse it, and it is not lethal if you take too much. So it's a relatively safe medication, and then you gradually taper people off of the buprenorphine.
Dr. Joshua Weiner with a serious problem becoming even more serious and some tangible solutions. Thanks for stopping by.
Thanks, Keith.